Okay, for your the injection checkoff, you have the hand washing and verifying the patient and verifying the MARF to make sure that you have the correct medication. For the subcutaneous injection, usually is used for heparin or insulin. You are gonna use either the 25 to 27 gauge needle. You're going to give the injection at like a 90-degree angle, usually in the abdomen. So abdomen would be at least 2 inches away from the belly button. And then you're just going to pinch the abdominal tissue in between your hands or fingers, and then inject the medication into that pinched tissue. So you're going to need a gauze pad, an alcohol pad, the medication, clean gloves, and then the MAR of the patient. So first, you're going to identify that you have the correct needle size. You're going to select your injection site. You're going to cleanse the injection area with the alcohol and let it dry. And then you're going to inject the medication and avoid moving the syringe once it's been inserted to the tissue. For the intramuscular injection, you're going to use like a 20 to 25 gauge needle, again at a 90-degree angle. And then after you do the injection, you're going to pull back a little bit on the syringe to make sure that there's no blood return. You can usually give that in the deltoid or the buttocks. You're going to use the Z-Track method and hold the needle like a dart as you're giving, and then slide your fingers open and then do the shot in between your fingers. So again, identifying the correct needle size, you're going to find the injection site to which you're going to use, cleanse it with alcohol and let that dry, and then inject the medication and avoid moving your syringe once it's inserted. For the intradermal, that's usually for like the TB injections or maybe an allergy shot. For the TB injections, they have to get them checked within 48 to 72 hours. You're going to use 1/8 to a 5/8 inch syringe. And when you're giving the injection, you want to make sure that the needle bevel is up at like a 5 to 15 degree angle. And you're going to inject it underneath the dermis skin slightly so that you are able to make a little bubble. And again, for the intradermal, you could do it for like inner forearm or upper back, and you would need a gauze pad, the alcohol pad to cleanse the injection site and let dry, and then the medication, your gloves, and the MAR of the patient. And I think, for subcutaneous too, that's usually for heparin or insulin. And the 90-degree would be more for like an obese patient, and 45 degrees would be more for like your average person. I think that's it for the injections. Thanks. I was also just gonna show you in doing this, so you're gonna insert this here and then flip and pull back a little bit, and then push it in to get the vacuum, and then pull back the amount of medication that you need. So if I was giving 1, I would want to make sure that the end of that the black line is equal to that line that I want to give for 1. Okay. Okay. And then these ones would be the ones that I would use for the insulin, and always have a nurse like double check the dosage since it's so tiny on there. And again, you would just open and then get the vial, place in, pull back, tap it to make sure to get out the air bubbles, and then have another nurse verify the dosage and give the injection